Africa faces a pivotal moment in its fight against the coronavirus as cases and deaths rise after eased lockdown and travel curbs, the regional director of the World Health Organization warned on Thursday.
The resources we've had to redirect to fighting the pandemic have set back our efforts to provide housing, healthcare, water and sanitation and education to our people.
Over the past month, there has been a 7% average increase in weekly COVID-19 cases across the continent and an 8% average increase in weekly deaths, according to the African Centers for Disease Control and Prevention.
With rapid testing, authorities can stay a step of COVID-19 ahead by scaling up active case finding in challenging environments like crowded urban neighborhoods and communities out in the countryside.
Today marks the beginning of the 33rd week since the first case of COVID-19 was reported in Kenya on March 13th. The last time the country recorded over 4,000 cases in a week was in mid-August, when the government's imposed restrictions were still in place. 631 people have tested positive for COVID-19 from a sample size of 6,142 tested in the last 24 hours, bringing to 47,843 the number of confirmed positive cases in the country. 14 patients have succumbed to the disease, bringing the fatality to 884. The most affected African countries in terms of the number of positive cases include South Africa, Morocco, Egypt, Ethiopia, Nigeria, and Kenya.
It is in the spirit of this new global deal that we call on the international community and our international partners to support the rollout of a comprehensive stimulus package for African countries. This will enable African countries to not only mitigate the health impacts of COVID-19, but to aid us in the immense task of rebuilding our shattered economies.
The Southern African region is the most affected by COVID-19, both in terms of number of confirmed positive cases and deaths.